serious cash. Kevin paid off his debt in full in just 2.5 years. Call 800-239-0791 for a free consultation. 800-239-0791. 800-239-0791.
Making the case with Unique. Decoding the country's legal system.
The issue of his guilt or innocence wasn't at issue for the Supreme Court.
Making the case tonight at 9 Eastern, only on BNC Truth.
Dramatic increase. The Delta variant now accounts for 83% of new COVID-19 cases in the United States. We'll look at the impact that's having as hospitalizations increase and vaccinations slow down. Billion-dollar settlement. 3 of the nation's largest drug distributors settled a lawsuit with New York State over their alleged role in the prescription opioid epidemic. Could a national settlement deal be close at hand? We'll have a live report. And Weather Maker, as hot and dry conditions fuel wildfires in the West, we'll take a look at one fire in Oregon generating so much energy that it's actually changing the weather. Welcome to The World Tonight. I'm Nayara Huck.
I'm Kelly White. We begin this hour with COVID-19 developments from and about the nation's capital. As we learned today, a White House official and a staff member for House Speaker Nancy Pelosi, both fully vaccinated, have tested positive for COVID-19 after attending the same reception last week with Texas Democrats. 6 of those Texas delegation have also tested positive for the virus. And this comes as the nation's top health experts are sounding the alarm over and over again about the spread of more transmissible Delta variant of COVID-19 and calling for Americans to get vaccinated.
The Delta variant now represents 83% of sequenced cases. This is a dramatic increase up from 50% the week of July 3rd. In some parts of the country, the percentage is even higher, particularly in areas of low vaccination rates. The message from CDC remains clear. The best way to prevent the spread of COVID-19 variants is to prevent the spread of disease, and vaccination is the most powerful tool we have.
Doctors and nurses are preparing for challenges that may come as the Delta variant continues to spread throughout the country. BNC's Derek Lewis is live down in Houston with more on the increase in hospitalizations and how healthcare workers are responding.
Well, Kelly, hospitals around the country are dealing with staffing shortages as hospital beds are in short supply due to COVID-19 cases. Doctors fear the Delta variant will burn out frontline workers and limit their resources.
Staffing is really an issue because burnout, number one. We went through this in the winter surge in January. We lost staff numbers after that.
In the first week of July, Houston Methodist in Texas says 92 of 158 patients with COVID had the Delta variant. The hospital is already preparing for a worst-case scenario.
We're learning to adapt and cope and how to, flex in terms of space and converting beds to COVID beds and those sorts of things.
Hospitalizations are increasing around the country, including in California, with most patients infected with the Delta variant.
We see that every case of hospitalization with COVID has to do with those who are unvaccinated. So we have a big problem still out there.
The White House says about 97% of hospital beds in the country are filling up with people who are not vaccinated. While beds become limited, hospitals are also seeing staff shortages, forcing staff to not only care for their patients, but each other.
We just all try to take care of each other and, talk to our coworkers, make sure that they're doing okay and try to support each other. But it's been a tough time.
Health experts believe the number of cases will continue to go up while they push for people to get vaccinated, including their staff.
Just like what we're seeing with our patient population, we have unvaccinated staff members. And although they're doing yeoman's work in our hospital, it's affecting our ability to keep them in if they're not vaccinated.
Hospitals are calling this surge a fourth wave in cases as they continue to see a rise in cases in the emergency rooms this summer. Kelly?
Such an important story and time right now that we're having there. Do health experts believe people should return to wearing masks?
Well, there is a possibility they believe that this country could take a step back. Some doctors say they are upset with the CDC for lifting the mask mandate, while there is still a risk of catching the virus when people are in close proximity to in closed areas not wearing a mask. Live in Houston, I'm Derek Lewis for BNC.
Derek, thank you for that. And just last Friday, CDC Director Rochelle Walensky characterized what's unfolding across the United States as, quote, a pandemic of the unvaccinated. But what will it take to persuade unvaccinated Americans to get vaccinated? Here to break it all down for us, Dr. Reed Tuckson, co-founder of the Black Coalition Against COVID-19. He joins us again in this hour. Dr. Tuckson, welcome back to the program. Derek said something in his report that was very telling. And that's the fact that CDC offered some a lax in restrictions, if you will. They didn't make it a mandate across the country. And as you know, that has caused some confusion. And Dr. Anthony Fauci has talked about that as well. But he also stated today the reason for that is that the CDC wants to allow local health communities to decide what's best for their community. Is that the right approach, or should everyone get in lockstep on wearing masks?
It very much, Kelly, to a very great question, depends on really where you live. If you're living in an environment where there really is almost no transmission and no cases, then you can behave in a way perhaps that is different than if you are in one of these growing communities that are having such an increasing episode and experience with this very, very dangerous Delta mutation. But let me be very clear. The places where you are immune from this and where it is low is very, very small. We